This video is designed to highlight the differences between skill and capacity deficiencies with regard to the squat and deadlift. We will consider two athletes and analyse their movement in order to ascertain whether they have a skill or a capacity issue. Skill deficiency suggests that the athlete lacks the understanding of how to perform the movement, whereas a capacity deficiency suggests the athlete cannot perform the movement correctly due to a joint immobility, a muscle weakness or tightness, or a combination of these factors. Here we have an athlete performing the back squat. The athlete is a middle distance runner with minimal experience in the gym. She has completed bodyweight workouts but has only lifted weights a few times. As you can see, the movement is jerky and uncoordinated, and the athlete seems uncertain in her movement. She initiates the movement with the flexion of her knees, which move forward well over her toes, meaning her centre of balance is on her forefoot rather than midfoot to heel, which is optimal. It can be seen that this is most likely a skill issue due to the fact that even over the relatively few repetitions completed, the athlete starts to move more confidently. From this angle, we can see the athlete's heels raising off the floor as she descends. Her centre of motion is too far forward, so the weight is shifting forward onto her toes rather than to the midfoot. It's more prominent on the left-hand side than on the right, and she has a hip shift to the left as well. From this angle, the athlete shows good depth with thighs almost reaching parallel and a good upright spinal angle. However, because of the raised heels, the knees are aligned a long way over the toes. This image highlights those issues accordingly. In order to ascertain whether there was a capacity limitation, the athlete performed a knee to wall dorsiflexion test. On the right side, she scored 12 centimetres, and on the left side, she scored 9 centimetres. This would indicate that there is potentially a capacity issue with regard to the left side dorsiflexion. On discovering this, the athlete highlighted a previous injury on her left leg, an avulsion fracture to the tibial plateau, which was subsequently immobilised for 8 weeks after the injury. This was a couple of years ago, but could be the reason for the slight difference in ankle mobility. Although there was a difference in dorsiflexion between right and left, skill and capacity issues are not exclusive, and due to her training age and the coordination of movement, it is felt that this is still mainly a skill acquisition issue. Therefore, the athlete was shown a pole squat in order to aid her in learning the appropriate movement. During her first attempt, you can see she has capacity in her ankle dorsiflexion. However, her back is rounded and her weight distribution is also still too far forward. After being provided with some verbal and visual cues, her form improves and she begins to understand the movement better. The athlete is then taught a goblet squat. By loading at the front, this allows her to shift backwards more easily, providing her with a proprioceptive cue, as well as a visual cue using the mirror. We can see from both the pole squat and the goblet squat variations, the athlete's dorsiflexion limitation is not a problem. Therefore, this confirms that this is most likely more a skill deficiency than a capacity deficiency. When analysing the goblet squat further, we can see the athlete has managed to get her thighs parallel with her heels remaining in contact with the ground. Finally, the athlete completes a box squat. This also helps with teaching her the appropriate squat pattern, however this time loading on the back rather than at the front. Showing the athlete she needs to shift her weight backwards onto her midfoot and heel, whilst also maintaining a straight spine. Now we can see the difference that a short amount of training has made to the athlete's squat technique. She is far more confident in her movement, reaches a satisfactory depth with her thighs parallel to the floor, her spine is straight and the bar is positioned in line with her midfoot, whereas previously it was aligned in front of her toes, and her heels were raised. This highlights that although there were potentially some capacity issues, the main reason for the lack of ability was a skill deficiency, and this has been vastly improved in just 30 minutes of training. Here we have our second athlete performing a back squat. He has good proficiency in the movement and a training age of approximately 10 years. He's played professional rugby for a number of years but is now retired. He does resistance training regularly, however, has not done much barbell work in the last 6 months. From this angle, we can see that he has good depth, going well below parallel, and has a good stance with the bar aligned over his midfoot. As he starts the ascent phase, he has a slight forward lean, which would suggest iliopsoas are tight, and there could be some weakness of the gluteals. From this angle, we can see the left knee moving inwards and the body weight shifting slightly to the left. This would further indicate the type hip flexors, iliacus and psoas major, as well as adductors, and a gluteal weakness. When we slow the video down, these capacity deficiencies can be clearly highlighted. The athlete was wearing old trainers, so he was lent a pair of lifting shoes. This should help stabilise the left-hand side because he highlighted the previous injury to his left ankle, which could go some way to explaining the capacity deficiencies of the left-hand side. However, although his ankle appears to be more stable, his body weight is still shifting to the left and he is showing a left knee valgus. The athlete is required to complete a number of stretches and exercises in order to help overcome these capacity deficiencies. The first exercise prescribed is a single leg pistol squat. On the left hand side you can see the knee valgus and also a significant forward lean as well as a lack of stability. When compared to the right hand side, the knee is far more aligned to the hip and toes. The athlete is balanced, under control and shows more strength. The second exercise is a banded goblet squat. The band forces the knees to track over the toes and prevents knee valgus while increasing glute activation when done correctly. Loading at the front with a kettlebell also increases glute activation, which has been highlighted as a weakness for this athlete. Single leg glute bridge is also an effective way of unilaterally loading the glutes and hamstrings on the left hand side to improve strength. The athlete completed an isometric hip flexor stretch prior to this in order to allow for greater range of motion at the hip and increase concentric contraction of the left gluteus medius. Here we have an athlete performing a deadlift for the first time. She said that she has done a deadlift before with a previous personal trainer, so she wasn't given any coaching cues prior to her first lift. The weight was kept at 35 kilos in order to challenge her but not to potentially cause any injury. The athlete does not know how to set up and the bar is aligned way in front of her toes. She immediately extends at the knee, reducing any potential contractile force generated by the gluteals and hamstrings, and she lifts using a rounded spine after an initial aborted attempt. After providing the athlete with some simple coaching cues and giving her the correct setup advice, we can see a vast improvement. Her spine is straight and she has her gaze upward. She loads through her midfoot and uses her gluteals and hamstrings to lift the weight rather than her lower back. We can clearly see that this was a skill deficiency because within 2 or 3 minutes and a simple explanation of how the exercise should be executed, she makes the deadlift look very simple. This image clearly shows the difference in technique after a few minutes of coaching cues. Here we have a second athlete performing a deadlift. He has a smooth technique with a good setup. From this angle it shows the athlete engaging and remaining tight through the entire movement. The bar follows a positive C-shaped trajectory, moving backwards initially to make way for the knees and then coming up in line with the hips until the glutes are fully engaged. From this angle, however, we can see the weight shifts over to the left and the left knee valgus is evident. It is more pronounced during the eccentric loading of the hamstrings when lowering the bar to the ground, but is still evident in the concentric phase as well. This highlights the body weight shift to the left and the fact that the hips are not aligned parallel to the floor. When the footage is slowed down, the left knee valgus and the body weight shift to the left is very evident. The athlete has been advised to perform unilateral glute extensions in order to build up more strength in the left gluteals, as well as putting Romanian deadlifts into his training program in order to improve eccentric hamstring strength. We have seen 2 athletes completing a back squat and a deadlift. One of the athletes had very clearly defined skill deficiency, and with some simple coaching and a few derivative exercises in order to provide proprioceptive understanding, she was able to improve her technique very well in both the exercises well within an hour. The second athlete had a number of capacity issues, mainly a left side gluteal weakness, an iliopsoas tightness which manifested in a left knee valgus during both the squat and the deadlift. With some specific exercises designed to improve gluteal and hamstring strength, both concentrically and eccentrically, this athlete should improve his stability and perform more proficiently. Here we have 2 very clear examples of how skill and capacity deficiencies are by no means exclusive. However, with the right coaching cues and exercise selections, improvements can be made.